Hello, I'm Ryan Cruz, and I'll be presenting our group study on offloading. So as a bit of background, the total contact cast and knee-high irremovable cast walkers are currently considered the gold standard for offloading diabetic foot ulcers. However, removable cast walkers are used much more frequently in practice, and knee-high removable cast walkers are actually presently considered the second choice option for offloading wounds. Now, in previous research, we've actually been able to objectively show with removable devices, as offloading adherence increases, so does healing of diabetic foot ulcers. We also found within that study that self-reported unsteadiness was a significant predictor of non-adherence to offloading devices. Subsequently, we believe if we're able to limit some of the disincentives associated with offloading devices, such as their impact on balance, imposed limb length discrepancy, and device weight, we may be able to improve adherence with these devices. And so we'd like to frame the question a little bit differently. Instead of simply asking, will the device work for the wound, we want to ask, will the device work for the patient? So in prior studies, we've actually shown that short leg removable cast walkers provide similar offloading as traditional knee-high cast walkers. We've also found that comfort and gait tended to improve with a short leg walker and with a contralateral lift, again in comparison to a traditional knee-high cast walker. So the purpose of the present study was to compare compensatory responses to perturbations in knee-high removable cast walkers in contrast to a short leg removable cast walker paired with a contralateral lift. And for the study, we recruited 18 participants at risk for diabetic foot ulcers, and over half of them had actually experienced a fall within the past year. For the procedures, we analyzed subjects under 3 different footwear conditions. We studied them under bilateral athletic shoes, in a short removable cast walker paired with a contralateral lift, and lastly in a knee-high cast walker with no lift. For the perturbations, we did one set of perturbations via waist pull mechanism, in which we loaded a spring scale and then rapidly released that load, and did subsequent trials, increasing the load each time in order to figure out what was the minimum load required in order to induce a stepping response. And we did this both with anterior directed as well as posterior directed waist pulls. We also did treadmill perturbations on the treadmill system, in which the treadmill was turned on momentarily for each trial at a fixed acceleration. And then we subsequently increased the maximum velocity for each trial in order to figure out what was the minimum velocity required in order to, again, elicit a stepping response. So in these first videos, you can see that testing done for an anterior directed test. On the treadmill, we also did lateral perturbations as displayed here in the second set of videos. In addition to the perturbation testing, we also asked patients to self-rate their stability in each footwear condition using a visual analog scale. In the results, we can see across all 5 conditions, the short leg walker with lift had better stability outcomes. However, they were only statistically significant for anterior waist pulls, anterior directed treadmill perturbations, as well as patients' self-perceived stability under each footwear condition. Ultimately, when we think about falls, they occur as a result of individuals to have an improper recovery or compensatory response to a loss of balance. In the present study, we were able to show that when patients were provided a short leg walker with a contralateral lift, they had better compensatory responses than when they utilized a knee-high removable cast walker with no lift. We do believe that these results, if translated to actual active care for patients, may result in increased adherence and improved wound healing under the condition of a short leg walker with a contralateral lift. However, more research is required in order to validate this hypothesis. And with that,